In its report today, the Oregon Health Authority says 26 of those people who passed away had underlying health conditions. Fox 12's Drew Marine digs into what really is considered to be an underlying health condition and how people with them can stay safe. Drew?
That's right. It can be as simple as being a smoker or as serious as having chronic liver disease. Dr. Jennifer Vines, who works here at Multnomah County Health, says even if you are considered healthy, we still need to take this virus seriously so we can protect people with underlying health conditions. While the Multnomah County Health Officer, Dr. Jennifer Vines, says people with underlying conditions may not be more likely to get the virus, they are more likely to suffer its more serious effects when they get COVID-19. Tuesday, the Oregon Health Authority reported more than 1,300 new cases and 36 more Oregonians lost to COVID-19, the highest daily death count to date. 26 of the deaths reported Tuesday were people with underlying health conditions.
I haven't done an exact analysis of how many deaths have been associated with underlying conditions. I can say just my eyeballing scan is that the majority.
So what is classified as an underlying condition, and how much more likely is someone going to be hospitalized with COVID because of it?
We see people with cardiovascular disease as being 5 times more likely to be hospitalized. So that's disease of your blood vessels, your heart. We see chronic liver disease as putting people at 4 times the risk of hospitalization. Obesity, so just carrying extra weight on your frame, to about 2.5 times increased risk, similar for people who are current or past smokers.
These are all conditions Vine says they're seeing in their local COVID-19 data.
And I'm sad to say that a lot of the conditions that I just rattled off even here locally are relatively common, especially in our Black, Indigenous, and communities of color who have had fewer chances to be healthy and who suffer from some of these chronic conditions.
Vine says the best thing people with these conditions can do is stay as healthy as they can. And she has some advice for people who think they're immune because they don't have underlying conditions.
Chances are you have someone in your life with one of these underlying conditions. Those are reasons for all of us to be really minimizing our socializing, and when we do socialize, taking really careful precautions to avoid spreading this virus to people who are going to suffer some of the more severe consequences.
Vine says as far as a vaccine goes, it's still unclear where people with underlying conditions fall on the priority list. Live in Northwest Portland, Drew Marine, Fox 12 Oregon.